Yes, indeed. So, you know, a lot of times we don't talk about this boy sitting in front of you, the spine.
Yes.
So let's talk about how important that spine is to health today.
Well, your spine is the lifeline of your body. So every nerve message, every single nerve message going from your brain to your body's got to go through it.
Okay.
So it's important that your spine be healthy in order for you to be as healthy as you possibly can be and feel your best.
Is it simply, you know, we're just talking posture here, or is it more than that?
Well, it's more than that. The alignment of your spine has a direct impact on your posture. So people that have good postures typically have really good alignment in their spine.
Yeah.
And vice versa. You know, if you have poor alignment in your spine or you have poor posture, you typically are going to have poor alignment.
Well, it's interesting they'd asked about that, and you talk about alignment and how important the spine is. When I heard about chiropractors so many years ago, I just thought they were people with back issues and problems. But that's not true.
Not necessarily.
Yeah.
Now, most people that go to the chiropractor go because of some type of back or spine-related pain, like neck pain.
Yeah.
Most common conditions are neck pain and back pain, leg pain, hip pain, shoulder pain, arm numbness, things of that nature, headaches. When I went to the chiropractor because of a football injury that I had in high school, and I developed a bad alignment problem in my upper neck from a bad tackle. And I developed horrible migraine headache problems, and that's how I got to the chiropractor.
Okay.
But when you understand that your spine literally is connected to every physical function in your body, you begin to understand that it's much more than just getting rid of back pain.
One of the things I noticed coming to you, and I've been coming now for at least a year, and Pat longer than that, much longer, all ages. You ask me little babies, right?
Yes.
And guys, you're a whole lot older than myself. So why the little babies? Is that the preventive care, or are they actually coming because of?
There's two reasons that people go to chiropractors.
Okay.
Primarily. And first is because they have some type of a problem, health problem, or we want to prevent future health problems. So the truth is that most of our patients come in that are adults. Well, they all have family members. And when they begin to understand the importance of getting their spine checked, first of all, to make sure that everything's in good alignment, and then keeping it that way, and by keeping it that way, that helps to ensure long-term health and wellness. For example, we know people that have healthy spines and get their spine checked on a regular basis are seriously among the healthiest people on the planet. So children, our youngest patient right now is 5 months old.
Oh my goodness.
And interesting story, she has a problem with a droopy eyelid. She was born that way. And she has some type of a neurological problem that nobody really understands. But when we checked her little spine, actually her mom came in with the problem, and she had her mom sitting on her lap, and I noticed this problem with her little eye. And when I asked her about it, she started telling me that it had been diagnosed as a neurologic or a nerve problem that was affecting her ability to keep her eye open. And so when we decided to examine her, we found a problem, a bad problem with her upper neck alignment. And so when we started to correct, and we're assuming that happened during the birth process. So as we started to correcting that, now she's only been a patient for not even a month, and that little eye is already 50% better.
Wow.
Isn't that interesting?
That is very interesting.
So I think it's the only patient we've ever had in my 33-year career that came in with that particular problem, but children often come with ear infection problems, kids that get sick a lot. Sometimes they can't hold their heads straight up, but more often than not, it's because mom and dad found that they had a problem. They wanted to have their children checked and wanted to make sure that their little spines were healthy.
Interesting.
And getting back to chiropractors and their medicine, how does that relate to our general, practitioners, doctors? Do they see the benefit of chiropractors and working with families?
It wasn't always that way.
That's what I'm thinking.
30 years ago, chiropractors and medical doctors, really, they were like cats and dogs.
That's what I
we
thought.
just didn't get along. But nowadays, it's completely opposite. We have more medical doctors as patients that come in as patients, send their families, and refer their patients for our care in the last 5 years than in the last 25 put together. So attitudes have changed a lot. And I had one medical physician came in to see me, and he was a radiation oncologist, young doctor, and he developed a lower back problem that he had never had before. And when I asked him, so you didn't have an MRI, you didn't go to the neurologist, you didn't go to the orthopedist, you didn't go to your family physician, why did you come here first? And he said, well, because of all the research that I've looked at, you're the guys to go to for those problems. You're the guys that help more people with that than anything else. So it's taken a
Yeah,
while.
It takes a while.
And it's not completely quite where we want it to
Yeah,
be,
yeah.
but it's better than it's ever been.
Sure. Yeah, I know, of course, we go to Dr. Jaddo. We've had Dr. Jaddo on our show. And when I mentioned that I was coming to, see you and everything, she highly encouraged it.
Yeah.
And she said, that's good. And of course, she thinks I'm a hypochondriac anyhow. But anyhow, she's like, but she really said, no. And so we work hand in hand, and she wants to know what you're doing, and then, the whole bit. So,
Well,
yeah.
the truth is, that healthcare has gotten so sophisticated, and the human body is so complex that there's no one specialty that has all the answers. So I'm really grateful for, chiropractors are just as guilty as the medical doctors of being,
Sure.
the cat and dog
Sure.
fight thing. But you realize that, my goodness, thank goodness we've got medications when we need them. Now we're very against over prescribing.
Right.
And unnecessary surgeries, of course.
Yeah.
But man, when it's the right thing, it's the right thing, and you get to the right doctor and you get the right treatment. It's what you need. So,
Dr. John, a lot of people all of a sudden decide they're going to join that gym. So they go in there and they get to lifting weights. I'm guilty, right? And you can do all that walking and all that kind of stuff. And you're probably sometimes doing more damage to yourself than what you actually know you are doing, because of your overexcelling. So are you seeing a lot of people coming into you because they've hit that gym and they realize they'd have messed up?
well, just yesterday, this is going to sound like I'm making the story up. I promise you I'm not. Just yesterday, a second-year med student from Hershey Medical School came in to see me, and he, a couple of weeks ago, went to a yoga class for a couple of hours.
A couple hours.
A couple of hours, and the next day couldn't get out of bed.
Wow.
Oh my
Because
goodness.
he irritated a pre-existing back problem that he had that had not been given any problems. So if you have a weakness in your spine, if I kind of take it back to your spine, what chiropractors look for when a patient comes to us, primarily we're looking for alignment in the spine. Your spine's made up of 24 individual vertebrae. You've got 7 in your neck, 12 in the mid-back, which attach to your rib cage, and 5 lumbar or lower back vertebrae. Well, in the spine, between the individual vertebrae, between every vertebra, there's a nerve opening. And out of that hole, or that nerve opening, comes a nerve. Inside your spine, there's a canal or a tunnel that runs from your head all the way down to your belt line. And between each of those 24 vertebrae, we have a nerve that comes out on the right and on the left. Well, those nerves go to and connect to literally every tissue, organ, and cell in your body and make it function. So what happens when a patient comes into the chiropractor is pretty simple. So if you have, for example, if you're having problems with your right shoulder, or you're having what I like to call neck, arm, hand syndrome, where you've got problems with your neck and now you're beginning to have problems with your arm, or carpal tunnel syndrome, or numbness or tingling or weakness in your hand, we're going to go to the part of the spine. It's not rocket science. You go to the part of the spine where the nerve connections come out that go to that part of the body, and if there's a problem there, we take an x-ray of it. If there's a problem with the alignment there, the chances are really, really good that if we can improve the alignment, that the body's going to heal it after we get the pressure off the nerve going to that part of the body. And it's no different than your heart, your lungs, your liver, your spleen, your kidney, your eyes, ears, nose, and throat. Every part of your body is connected to nerves that make them function. So if we check a person's spine, what we're really looking for is to see if everything's in good alignment. And if they're not, we want to get it back into alignment. So if I could digress just for a second, chiropractors are kind of to the spine and to the nerve system, sort of like a cardiologist is to the heart, maybe an orthodontist is to the teeth. So that's our specialty. So we check to see that the alignment's good, and if it's not, we set about a course of care to get the spine corrected, get the vertebra back in alignment, take the pressure off the nerves. As those nerves heal, which is the body's natural response, the person's condition typically will correct. So if you have a problem with your digestion, we're going to check the middle part of your spine where the digestive nerves come out. So if we take an x-ray and there's no problem with the alignment there, not a thing a chiropractor is going to do to help you with that. But in the same hand, if you've got a bladder problem, or you've got asthma or allergy problems, or you've got migraine headaches, we're going to look way up at the top. If you've got a bladder problem, we're going to look at L3. If you've got leg or lower back or lower digestive problems in your lower colon rectum area, we're going to look at the nerves that come out of your very bottom lower back and look for problems there.
Fascinating stuff, absolutely. I know, just using myself as an example, you mentioned that taking the x-ray, you noticed that there was some narrowing, I guess, of some of the area. And then that begins, I guess, what, to do like a pinching or that kind of thing?
Yeah, it's a great question. I'm glad you brought it up, because it's a common misunderstanding, and it's really pretty simple. Again, your spine is made up of, you know, bones, and these are the spinal discs. The discs are the cartilage space. Think of them as spacers. They keep the vertebra apart so that the nerve opening remains nice and large. So there's lots of room around it. What happens when you get a vertebra that gets out of alignment, it's a little bit like a car that gets out of alignment. The softest thing that's there starts to wear out. In the car, it's the tread on the tires.
That's right.
In the spine, it's the cartilages that make up the disc and these little facet joints in the back. So what happens if your spine gets out of alignment, and the way it gets out of alignment is typical, common sense kind of things. Like in my case, it was a sports injury or sports impact. You know, think about a kid that plays soccer and how many times they had the soccer ball, or they run into somebody, or the base runner runs into the catcher at home plate, and the collision between the two outfielders or whatever. Car accidents, slips and falls, lifting injuries, even stress long term from sitting at computers can cause spinal alignment problems. But as your spine, if it gets out of alignment and it's allowed to stay that way long term, things start wearing out. Think about the car. So you take the car into the shop. It's starting to show wear on the tires. You take it in the shop, you get it realigned. Doesn't do anything to fix the wear that's already gone, but it does guarantee you're going to get the life out of the rest of the tire. So the spine, if we have degeneration or arthritis or wear and tear or a disc bulge or a disc herniation, almost all of that goes along with a misalignment. You almost never see it without that. So chiropractically, we can help people with all those problems, but getting the spine back into alignment takes the pressure off the disc, and it helps to slow down or stop, in many cases, that additional wear and tear over the long term.
One of the things I've observed over the last couple of years, you really expanded yourself in some other areas as well. You're doing stuff with laser treatments.
Yes.
And that also impacts. I know I came in because I was having difficulty. It wasn't carpal tunnel, but it was another issue in regard to my wrist area. And I think it was 5 or 6 treatments that seemed to dissipate, you know, that particular discomfort for myself. So why do people, what reasons that you use laser treatments?
Well, we're a wellness center.
All right.
And so a wellness center looks at the whole person. And chiropractic is, you know, as a profession, really looks at the whole individual. You're not just a heart, you're not just a stomach or a digestive system, because the nerve system really reaches and it affects the whole system. We look at it as a whole body. And so we have, for example, an excellent weight loss program that works really well. The deep tissue laser is an up and coming. A lot of people know about it, but all the pro sports teams have these deep tissue lasers, and they're great. That when you have arthritis in that thumb, which so many people get, golfer's elbow, tennis elbow, shoulder arthritis, things of that nature that only medicine really, and sometimes doesn't even touch, but you know, things that typically you're going to get cortisone shots for. It's a natural way of approaching those problems, and really what it does is it just enhances the body's own natural healing mechanism. So we also recommend nutritional supplements to help people to support them with all kinds of different conditions. It all works together.
And you also offer massages.
Yes, we do.
Okay, I haven't had one. I have to get one.
Well, we do. Yes, you should. We have to arrange that. So massages is got tremendous benefits. There's therapeutic massage and what we call wellness massages. So wellness is more for relaxation and stress reduction. Therapeutic massage, as the name implies, really is therapeutic, and it's trying to help you with a specific problem. So if you have a neck, arm, hand syndrome, we might recommend that we get some massage therapy to help work that area out, and it just has tremendous benefit.
I have to ask you about the table, because this guy I was talking to, he was so taken back by the table. He's like, oh, that noise, it makes it do. He said, well, I'm not sure. I said, well, it makes sense to me because it seems like the table gives when you're actually working with the person. But talk about the table and why does it make the noise, why does it give?
Okay, so when you go to the chiropractor and you get a chiropractic treatment, we call that a chiropractic adjustment or a spinal adjustment. It's an old term. I don't even know where they came up with it. But basically, you lay down on this fancy $15,000 table, and it's got all these little mechanisms on it that you know, you lift the little lever and it raises up about a half an inch. And when the doctor applies pressure, think about it, if your vertebra is out of alignment, we got to put it back. So we put our hand in a specific spot and we push, have the patient typically take a breath, let their breath out, and gently push that back into alignment. The table will drop, and it gives about that ½ inch, and that gives us some extra leverage, and it's a way of giving a chiropractic adjustment and doing it in a very painless way. In the old days, things were a little more barbaric. The old traditional ways, and not that they didn't work, but it's a little more, you know, twist, pop, crack kind of thing. This is the newer, more advanced methods are, you know, there's just literally almost no contraindications, and they're so safe and painless, really, at this point. Lots of people have fear about it, and that really, I think, has kept a lot of people away from chiropractors.
Absolutely.
Yeah, I think they're thinking 30, 40 years ago.
But I like, sometimes I don't think it's a great analogy, but it's a little bit like if you were a mechanic and you're using an old box wrench versus a ratchet wrench. So the newer tables give us leverage and make the job a lot easier than the old muscle way of doing it. Does that make sense?
And that's what kind of scared me from coming. I kept thinking they take your neck and they twist it and this and that, and I'm like, oh man, I could. But then after coming and experiencing you, and well, I'll let Pat come first. Right?
I'm talking about 5 years, right?
A lot of the husbands do that.
That's right. Let Pat come and see what's happening. But then, I'm really a huge fan of it now, and it makes sense. The thing that you talked about with me when I first came was that a lot of times people will start and then they stop. And you talked about the, losing that benefit that once you get involved, you really need to make it like a lifelong kind of thing. Talk about that a little bit more.
Yeah, well, there's two types of care. There's the therapeutic care, which a patient will come in with migraine headaches, or they'll come in with neck pain from a car accident, whiplash injury, you name it, whatever the condition is. So typically, we've got to work with the patient for a month or two, maybe 90 days, to get through most of that. Most of our patients in 90 to 120 days are feeling tremendously better. And we've got a lot of their spine corrected, or we've got the worst of it corrected. So at that point, the patient has a choice. Do they want to continue to come and try to and stay with it for the long-term prevention and wellness benefits? For example, we know people, we don't understand totally how, or why, but we know that people that get their spine checked, number one. Number two, get it corrected if there's problems. And number three, then maintain that correction long term. Go to the chiropractor on a regular basis, typically means once a month, sometimes a little more often depending on the situation. But they keep their spine strong and healthy and keep everything in good alignment. It just goes so far in terms of keeping their health statistics in a positive way to a minimum. In other words, we know from lots of research that's been done that people that go to the chiropractor on a regular basis don't have anywhere near the medical bills. They don't get sick as often. They don't take anywhere near the number of medications. And they get well, they don't get sick as often, and when they do get sick, they get well in about half the time. So I was sharing having this conversation with one of my patients who's a medical physician. He's also a researcher at Hershey Med. And I was explaining to him exactly what I just said to you. And I was very forthright and told him we don't totally understand why, for example, a person's white blood cell count will get stronger as they're under care, as their immune system will get stronger. Well, and his response to me as a researcher, I thought was interesting. I'll never forget it. He said, "We don't necessarily." He said, "John, it's not necessary. It doesn't necessarily matter why it happens. All it really matters is that it happens." He said it might take us 100 years to figure out all the whys. And if you know anything about researchers, they typically want to know everything and about why everything happens. So I thought that was an interesting response.
Now, one of the things interesting with your practice as well is kind of a family practice. Got a lot of family involved. Your daughter just recently got her passed her boards. So tell us about that in regard to how everybody got involved in some way.
Well, I was we have 12 or 13 chiropractors in our extended family.
Oh, wow.
I was the first.
Wow.
And as I said, when I was in high school, I went out to catch a pass. It was thrown too high. All I remember the stripes going around on the ball. They said I caught the ball at the peak of my jump. That's the last memory I have of it. I got tackled at the ankles and I got somersaulted onto my head and neck. I badly misaligned the second vertebra in my neck. We call that, by the way, the medical term for that is a subluxation. And that's what we call it when a vertebra gets shifted out of alignment. Well, our family had never been to a chiropractor before. I had never, at that point, I was 14 or 15 years old, never even heard the term chiropractor. That was a lot of years ago. So when I went to the chiropractor, he started helping me with these migraine headaches. Well, it turned out my dad had suffered with migraines for a long time. So he decided to go in and get his spine. I got help with migraines. He figured he would. So my mom was having some nerve issues. So mom went in, and then the chiropractor encouraged them to bring the rest of my brothers and sisters in just to get them checked to make sure everything was okay. And you know, my dad at the time was a school teacher, was hardly making any money, but it was, they found out that it was an affordable way to keep our family healthy and to keep us out of the medical doctor's office, you know, for the wrong reasons, not preventive reasons, but because we were sick and not needing to take medication, that kind of thing. So one thing led to another. I have two of my siblings became chiropractors. I was the first. My youngest, my brother, I only have one brother, and my youngest sister. So 3 out of the 4 of us. Now we've got cousins, and my brother married. His wife is a chiropractor. Now my daughter just graduated from Life University in Atlanta, Georgia.
Beautiful.
So if I could, I'd like to take a second and talk about chiropractic education, because a lot of people don't know that chiropractors are real doctors.
Yeah, I was going to ask about that too.
In the old days, they used to say, well, you're not a real doctor. They don't say that anymore. Because most people are beginning to understand that chiropractors go to school a long time, as long as medical doctors do. So my daughter, as an example, she has a 4-year degree in exercise science. And then she went to 4 years of chiropractic college, more than 4,000 graduate school hours to receive her Doctor of Chiropractic degree.
Nice, okay.
And she had to pass 4 national board exams and a state board exam in order to be licensed.
Wow.
And then every 2 years you have to have 24 continuing education hours in order to maintain your licensure. So there's a lot that goes into it. The average chiropractor comes out of school nowadays, not true when I came out of school 30 years ago, but nowadays comes out and has a couple $100,000 in student loans. Which tells you their education, that's what they come out with. Some of it they pay for. It's a lot. It costs as much money as it does to get a medical education. So you throw in an internship, and there's a lot involved.
In this field, do you know of, and especially in this area, I don't think I've ever seen one, people of color, African Americans in particular, do they enter in the field in chiropractic?
Yes.
Okay.
Yeah, but in large numbers now, and which is really exciting. And women. You know, I'll bet close to 50% of my daughter's classmates were female. Oh wow! And I would guess easily 40% were African Americans.
Wow.
And not just, you know, a lot of ethnicity now. That was not true 20 years ago.
Right, yes, yeah.
Very different.
I wondered about that, because I don't think I've ever met a person that was African American, or, you know.
Not in this, not in this area. But you go, this is Atlanta where she goes to school. And they have a lot of Puerto Rican students that come to that school, and it's fabulous. I'm just
now, is that the only university? Are there others that offer the same way to get into?
There are 18 different universities in the U.S. And there's others, and they just opened one in China. They've opened one in Italy. There's a number of international colleges now as well.
Okay, fantastic, good. Now, you know, your practice is not just, I mean, you're based in Hershey, but people come from how far away just to come to you? I know we come out of Harrisburg. I see a lot of the Harrisburg people, but
well, I have them travel about as far as Ohio.
Come on, really?
Oh, really?
They don't come on a regular basis, but I've had them come to have evaluations done, and then we try to find, you know, long distance patients. We try to find them a chiropractor that can take care of their particular problem, depending on what it is. But we routinely have people that come drive 2 hours each direction to get care.
Yeah, that's one thing I noticed. I said, you have a pretty large practice.
Yeah, a lot of people that come, a lot from Lancaster, York, Carlisle, which, you know, is amazing. There's a lot of chiropractors between here and there.
Yeah.
Also, one of the things you do, you work with the Amish community as well.
Yes.
And provide, services. Now you go to them.
Well, yeah, I don't anymore.
Oh, you don't?
My nephew and his wife
they
are both chiropractors.
Oh, okay.
They took over that part of my practice for 10
right.
years. Every week I would go down to an Amish farmhouse, and more than 100 people would come in buggies and in vans to get their spines checked. It was quite, they're wonderful people. It was quite an amazing time.
My goodness. Wow, I had no idea. Now, you did mention nutrition. I know we're going to run out of time, but I want to get back to that real quick. So, you know, people come, they, you know, get the adjustments, stuff like that, but there's things that we have to do. I say we have to do outside of just coming to your office. What would you recommend? I know it's the nutrition, but what other things can we do to keep that health?
Also, if you think about it, there's in order to be healthier, the typical things that we already know about are eat better, right? Clean up our diet, eat more organic food, more fruits and vegetables, especially vegetables, are king.
Okay.
Eat less fatty meats. Proteins are important. Meats are important, but not the fatty stuff.
Yeah,
So
yeah.
clean up the diet. We want to supplement our diet with vitamins, some type of,
Okay.
at least some type of general vitamin mineral supplement,
Sure.
because our foods are just not as healthy as they used to be,
That's right.
not as vitamin and nutrient rich as they used to be. Drinking lots of water, minimizing the sodas. Lots, get the the 3 whites out of our diet: white sugar, white flour,
Okay.
and white salt. So if we're gonna do flour, we're gonna do wheat, we're going to do get rid of the white sugar, and we're going to go with more natural, like honey and more natural sweeteners. Molasses, even though it's sugar, it's still more natural, healthier for you. And use sea salt instead of white salt, because sea salt has very little sodium in it, and it's actually like a mineral supplement. It's got all kinds of minerals in it, and they all have a salty taste. So you can use about as much of that as you want, with rare exception, and you don't have to worry about how much salt you're getting. But
yeah, because we did have the sea salt, but I thought maybe that's still salt. But you recommend that though?
So the number one thing, healthy spine and nerve system. Number one. Number 2, in my opinion, is diet nutrition. Number 3 is exercise. Then we got stress management and more water. And getting lots of rest. You got about it all covered.
What do you think of the stevia? I just want to throw it out.
Stevia is excellent.
Good.
It's a natural sweetener, absolutely.
Yeah. I was hoping that you would say that.
Yes.
I use stevia.
Yeah, please. It's way healthier for you than the artificial sweeteners.
Well, we're down to 2 minutes, and we're going to run out of time, and I just want to make sure you get your contact information. And I really believe in the work that you're doing, first off, and I look forward to coming down. So what is your information? How can people contact you?
Yeah, well, our practice is located in Hershey. We're right across from the roller coasters, right off of Chocolate Avenue, right behind the Chipotle restaurant. We've been there for a lot of years. And our website is MAD-Chiro, M-A-D, ChiroWellness.com. And our phone number is 717-533-6100.
Okay, real good. Well, this is fascinating conversation, and I really hope that more people will consider just taking care of their health, period. Because I know how important that is for me now. And, you know, sometimes when you're younger, for all of us, right? You know, you run around here doing these things, and all of a sudden it catches up with you. But if we take this stuff seriously, and if we practice it every day, I think we'll be a whole lot better off. And, you know, knowing about your spine is critical. So, you know, take to heart what Dr. John has given us today. Dr. John, thank you so much. And I hope that you will, you know, not only think about yourself, but think about your family as well. Make it a family project to have good health. I think that would be good, and you know, that way you have a support system. But look, I want to thank you so much for watching this program. As always, we love to have you as a viewer here on Life Esteem. We're going to see you next time. Be blessed on Life Esteem.